There's been a lot of conversation lately about the importance of improving health outcomes by focusing on equity. Health equity is simply achieving the highest level of health for all people. In order to move towards health equity, we have to first understand the social determinants of health. The social determinants of health are simply the places or conditions where you are born, where you live, where you learn, where you work, where you play, and where you age. Let's take a look. We all know that our biology, genetics, and culture play an important role in who we are as individuals and impact our health as well. In fact, you often hear people say things like, well, my family has a history of diabetes, high blood pressure, asthma, etc., so there's probably a good chance I'm going to get it too. Well, while there may be some truth to that, it's important for you to know that health is not just determined by your biology, genetics, and culture. In fact, where you are born, live, learn, work, play, and age all have a significant impact on your overall health. Let's break this down a little more. The social determinants of health are a broad range of personal, social, economic, and environmental factors that contribute to health. The Centers for Disease Control, or the CDC, breaks down the social determinants of health in these 5 categories. Economic stability. This area covers employment and income, how much a person earns or what kind of work a person does, being able to get and keep a job, expenses, debt, medical bills. Education. Early childhood education, higher education, or vocational training are all a part of this category. How much education a person obtains is associated with longer life expectancy, improved health, and quality of life. This area also includes things like language and literacy. Social and community context. Social supports include family and community support, social integration, and community engagement. However, it may also involve family and community rejection, including lack of support for the way a person chooses to live life. Racism and discrimination are also components of social and community context. Health and healthcare. Health-promoting behaviors like getting regular physical activity, not smoking, drinking, or using illegal drugs, going for routine checkups and recommended screenings, healthy eating or the lack thereof because of food deserts and the absence of healthy eating options, health insurance and coverage, access to health services, quality of care, or the linguistic and cultural competency of the healthcare provider. Neighborhood physical environment. Neighborhood and physical environment focuses on housing, transportation, safety, parks, playgrounds, and walkability. Access to parks and safe sidewalks for walking is associated with physical activity in both youth and adults. When we take a look at these broad categories within the social determinants of health, we can clearly see that they are all interrelated. For example, we know that poverty limits access to healthy foods and safe neighborhoods, and having more education is a predictor of better health. We also understand that when individuals and communities experience poor social determinants of health, such as unstable housing, low income, unsafe neighborhoods, or substandard education, the result is poor health outcomes. The conditions in which we are born, learn, live, work, play, and age all contribute to our health. When we are working with individuals, whether they're in our families, schools, places of worship, or communities, let's try to think more holistically about how the context of our lives impacts our overall health. Understanding the social determinants of health can help us move towards health equity.